Hello everyone, good evening. Welcome all to our webinar on artificial intelligence getting used in impact of COVID-19. Good evening to one and all joined us today. Good evening, Dr. Fatima.
Evening.
We already have few of our participants who have joined us now. So I think we should be waiting maybe a minute for them to enter the room and we'll begin. So before we begin, I would like to understand our audience the importance of discussing this topic on IFERP platform. So this is one of the most talked about topics in today's world scenario, that is artificial intelligence and its application towards COVID-19. So taking into this consideration, IFERP is organizing this free webinar on how artificial intelligence is being used in impact of COVID-19 across the globe. So as everybody knows that artificial intelligence, it do play a crucial role in case of healthcare sector as well as many other sectors. The role of artificial intelligence in mitigating COVID-19 has made a huge impact across industries and especially in the healthcare sector. For example, a case in point is that of the University of Copenhagen that is leveraging artificial intelligence to forecast the requirement of intensive care and ventilator support for patients in the early stages of infection. This is helping healthcare workers plan and optimize the use of ventilators. This is just one of those many use cases of artificial intelligence that is helping fight the pandemic. In addition to this, we do have many applications. So this is the reason why we have gathered here together, and we have got two experts in the field of artificial intelligence to discuss about this. So my dear attendees, you will be enlightened today about the introduction of artificial intelligence and its applications. You will be introduced to deep learning, industry of 4.0 practice, advanced manufacturing, and much more. So before we begin, I would like to introduce our organizers, IFERP, who has given us this platform to discuss worldwide and bring all the experts and at one platform in this pandemic situation. So as you know, IFERP, that is Institute of Engineering Research and Publication, which is one of the world's largest professional associations operating under Technorate Research and Development Association, dedicated for research and development in the field of engineering, science, and technology. IFERP is a leading publisher of scientific research works in highly cited, high indexed, and high standard international journals such as SCOPUS, SCI, ESCI, Web of Science, UGC, Springer, etc. IFERP is also a leading association of professionals from across the globe, conducting several international scientific events all over the world annually. This is truly a pride moment to be part of such an organization who has given us this platform in discussing and exhibiting the talent of our researchers. And I would like to also introduce to our attendees, our experts, our keynote speakers for the day. That is Dr. Fatima from Malaysia and Dr. Singham from India. He will be joining us soon. He's another keynote speaker, a very reputed speaker from India. And because of his busy schedule, he is not able to join us now. So he'll be joining us soon. Yes, firstly, I would like to introduce to you our first keynote speaker of the day, that is Dr. Fatima Suslawati Muhammad from Malaysia. She is an associate professor in the Department of Information Technology in Faculty of Informatics and Computing from University Sultana Zainul Abidin from Terengganu, Malaysia. She has obtained her BSc in Information System from Oklahoma City University from USA in the year 1997. And then she has also pursued her master's in computer science from University Kebangsaan, Malaysia. Then she obtained her PhD in computer science, specializing in pattern recognition from University Technology, Malaysia. Dr. Fatima is currently appointed as Head of Image Processing and Pattern Recognition Research Group at the faculty. At present, she is also involved in research in deep learning a part of human biometric identification. Dr. Fatima is an experienced lecturer. She has more than 20 years experience in teaching and research. She has taught various courses both in UG undergraduate as well as postgraduate level over the past 20 years. Dr. Fatima has published more than 100 journal articles, proceedings, and academic books to date. She has graduated more than 20 PhD and master students at present. Due to her vast experience and knowledge, Dr. Fatima has been invited to deliver her keynote and invited speech at several universities, conferences, and academic seminars, both nationally and internationally. She is also an invited speaker in academic and research for several institutions. Besides this, Dr. Fatima is also an appointed visiting professor and evaluator of postgraduate program, both nationally and internationally. Thank you, Dr. Fatima, for joining us in this busy schedule. Thank you so much.
Welcome. Welcome.
Yes, thank you so much for joining us and helping our IFERP members in sharing your expertise with us. Thank you so much.
Actually, I feel grateful to be with all of you today.
Yes, thank you so much. We are really honored to have you today. I would like to introduce to you our next speaker, Dr. Singham Jayantu, who will be joining us soon. He is a PhD scholar, PhD, MTech, and specialized in mining. He has also done his master's in counseling and psychotherapy. He is a former scientist of CMRI and NIRM from India. At present, Dr. Singham is working as a professor in Mining Engineering Department of National Institute of Technology from Rourkela, India. He has completed about 100 research and development projects sponsored by various ministries of Government of India and consultancy projects sponsored by various coal and metal mines of India, and authored over 250 technical papers published in various national and international journals and proceedings and seminars. He has participated in more than 100 national and about 30 international conferences as keynote speaker, guest of honor, and he's also the chief editor of Indian Mining and Engineering Journal. He is a National Mineral Awardee in the year 2000. He is also the Best Citizens of India Awardee in the year 2010. He is a very active member of Technical Committee Environmental Appraisal for Mining Industries of Orissa State Pollution Control Board from India. So that's so great of Dr. Singham, who is joining us today. Thank you to both our speakers who will be delivering their keynote speech. To all our IFERP members, thank you both of you and welcome to IFERP family.
You're welcome and thank you for inviting us.
Thank you. Dr. Fatima, would you like to address our researchers and professionals who have joined us today online? Many of them are watching us on YouTube as well. You can welcome them all.
Okay, good afternoon. Actually, Malaysian time is quite late. It's about, almost 7 in the afternoon. Okay, but thank you for giving me this opportunity to the IFERD. And also, thank you for joining us today. Hopefully, you gain something from my talk later.
Okay, sure. Thank you, Dr. Fatma. I think we can begin with the presentations.
Yeah,
and
sure.
Dr. Singham will be joining us in between.
Okay, I may start now.
Yeah, sure.
All right. So good afternoon, everybody. But first of all, I would like to thank the IFERD for giving me this opportunity to talk on the potential of deep learning in order to fight the COVID-19. Okay, as we mentioned before by Ms. Jazila, my name is Associate Professor Dr. Fatma Susilawati Muhammad from the Faculty of Informatics and Computing, University Sultan Zainal Abidin, or in short, I just mentioned UNIZA after this, in Malaysia. Okay, before I start my presentation, let me introduce some of the outline of this presentation for today. So I would like to introduce a little bit about the artificial intelligence, or in short AI, which I won't go further. And then what the AI can do for the pandemic. After that, some introduction to the deep learning, as I will focus my talk today solely or mostly on the deep learning, but why we need to adopt the deep learning. And then we go for deep learning and COVID-19 symptoms detection. And then I will talk about some existing applications that we have here in Malaysia for the pandemic detection. And last but not least is wrap up for the conclusion. Okay, now, what is actually the AI or artificial intelligence? So sometimes it's been called the machine intelligence. Okay, this intelligence actually is being demonstrated by the machines in order to mimic the human intelligence. Okay, since a long time ago, actually, the researchers are building the machines that becoming intelligent since the era of artificial intelligence starting from 1950s. But one question is how to make these machines intelligent. All right. Now, how does it work? Alan Turing in 1950, okay, he actually raised this question long time ago. Okay, can these machines think? Okay, so that the researchers that time, they try to replicate and simulate the human intelligence in the machine. Okay, that's why in 1950, actually, Alan Turing, he introduced a test on the intelligence whereby there is one human interrogator who interrogate the human and also the machine. They want to test. Okay, if the machine pass the test, so meaning that the machine has some sort of intelligence just like the human being. All right. So we can see the picture there. On our right is the human brain, and the left side is the machine brain, so that the researchers are trying to mimic the functionality of the human brain into the machine. Yeah? So this is what it's all about. Okay, then Russell and Novick, they introduced the 4 approaches of AI. Okay, first, thinking humanly. So In this, actually, they try to develop or come out, create a machine with minds, just like the human being. And then after that, the second approach is thinking rationally. So these machines are made possible in order to perceive, reason, and act, just like the human. Okay, the third one is acting humanly. So in this case, they teach the machine in order to behave just like the human. For example, perform the functions intelligently, just like the human. What can do, or what cannot do, and just some sort like thinking. And acting rationally. Okay, this machine is taught, okay, to have the intelligence behavior. If like for example, if you want to go shopping, then they must have some sort of features in order to help you in making your choice. So this is all 4 approaches of AI introduced by Russell and Novick. Okay, now, what is actually the deep learning? All right, deep learning is a family member of machine learning, a subset of machine learning. It is based on artificial neural network model, ANN, and it has 3 categories of learning representations, which is supervised, unsupervised, and also semi-supervised. The deep learning architecture, they consist of multiple hidden layers in a neural network, which is much more complicated compared to the traditional neural network. And it is actually a machine learning technique that try to teach computers to do what comes naturally to human. For example, it is common for the human beings to learn by example. They see other people do it and they want to do it also. Okay, this is tried to mimic by the machine, okay, in order to perform learning by example. For example, we have nowadays the innovation in the cars, driverless cars. So this machine enable to recognize a stop sign, or they can distinguish a pedestrian from a lamppost, or they can avoid any obstacles on the road. And another example, maybe this is actually one research group that I involved a long time ago. Okay, we developed a wheelchair assisted by robot. This robot is intended to assist the disabled person to go anywhere, including shopping, go home. And what they do is they are able to avoid any obstacles along the way and direct the wheelchair to the destination safely. All right. Or we also have other examples like what the Facebook do. The Facebook nowadays, they introduce what we call the recommender systems that can recommend either they can detect the face, okay, either the photos are posted by our friends on the Facebook, and they will suggest, is that us or not? Based on the unique or several facial features in that they program in their algorithm. Okay? So this is some of the examples of the deep learning applications. Now, okay, this actually I got from Oracle. We can see the differentiation between the artificial intelligence, machine learning, and also the deep learning. So artificial intelligence is introduced starting from 1950s. Okay, they try to mimic the human behavior. They try to mimic the functionality of the human brain at this time. Okay, and then starting from 1980s, the machine learning is emerged, which is the subset of the artificial intelligence. In this era, actually, the machine is able to learn a little bit, okay, without being told what to do only by the programming that program them what to do, so on and so forth. And the learning is happen in this era, in this architecture of machine learning, but it's only on surface or shallow learning. And then starting from 2010 onwards, the deep learning is introduced. It is a subset of machine learning which make the computations of multi-layer neural networks feasible, especially for the complex system or complex computations, because they are adding many or more layers, more hidden layers of the network architecture. Okay, now, okay, this is another figure that I would like to show you the differentiation between the machine learning and also deep learning. On the top, we can see the data is input, the image data in terms of the car image is input into the feature extraction process. So the feature extraction algorithm will extract the features in this phase, and then do the classifications by the classification algorithms until they are able to produce the output. Either it is actually a car or not a car. That is machine learning. But for the deep learning, the image of the car is input into the algorithm, and the algorithm are doing the feature extraction plus the classifications on their own. Okay, everything are done by the algorithm until they give us the answer, which is either it is indeed a car or not a car. You see the differentiation between the machine learning and also the deep learning. So that's why some researchers saying that the deep learning actually it is end-to-end architecture. You can just input some raw data and they do all the works until they provide you the output at the end. All right. Okay, now why we need to adopt the deep learning? What is the importance of adopting the deep learning? Okay, like I mentioned earlier, the deep learning actually is suitable for complex problems. Their complexity allows this type of algorithms to perform feature extractions on their own without or very minimal human intervention. Yeah? As they are able to deal with raw data, they have open access to the whole information, and so they could potentially find out better solutions. Okay, you just give them the data, they do all the work, and then they give you the answers at the end. Right? And the deep learning actually working better. They can provide better accuracy if we're working with the huge amount of data. If we have a smaller data set, so we better use the machine learning algorithm instead of deep learning. And it is preferable for complex problems, like if we try to solve the problem in pattern recognition or image processing, like to detect the images of people in the mass, or try to classify the images, or to match the image, like what the Facebook do. And sometimes like in natural language processing, speech recognition, so on and so forth. Okay, now I got this from Google actually. It shows the trends of deep learning, okay, in today's applications. If you see the chart, so the patterns are increasing. So meaning that there are more researchers are using deep learning in the applications due to its ability in providing better results and also can solve the complex problems. Okay, now I will talk a little bit about the COVID-19, the emergence of COVID-19. The coronavirus disease, or in short COVID-19, is an infectious disease caused by a newly discovered coronavirus. It is originally detected in Wuhan, China in December 2019 and declared as a pandemic by WHO, World Health Organization, on 11 March 2020 due to its fast spreading of the virus across regions and groups. This virus can cause acute respiratory illness and even fatal acute respiratory distress syndromes, or ARDS. Okay, now according to WHO in 2020, there are 3 categories of symptoms of COVID-19. Okay, the most common symptoms are fever, dry cough, and also tiredness. And there are less common symptoms, which are itches and pains, sore throats, diarrhea, conjunctivitis, headache, loss of taste or smell, or a rash on skin or discoloration of fingers or toes. However, this disease can be led to a fatal case. And usually it is based, they having the serious symptoms like difficulty breathing or shortness of breath. Like we all know that these viruses are attacking our breathing organ, the lungs. And also we might be having the chest pain or pressure on the chest, and also loss of speech or movement. Okay, this data I got from WHO. And how to prevent ourselves from COVID-19. Okay, according to WHO, we need to wash our hands regularly, maintain at least 1 meter distance between you and people coughing or sneezing, because we all know that we need to avoid from getting touched with the droplets from the nose of the infected patients of the COVID-19. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs, because they attack the lungs, our breathing organs. So that's why at this stage, usually the patients are getting weaker and weaker. And also, last but not least, is practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. Okay, we'll see the current testing and diagnosis of COVID-19. The COVID-19 has led to complications such as acute respiratory disorder, the heart problems, and secondary infections in a relatively high proportion of patients, and thus significant mortality. So the early detection is important, and the commencement of treatment in severe cases is key to reduce the mortality rate. Currently, the most common test technique used for COVID-19 diagnosis is a real-time reverse transcription polymerase chain reaction, or in short, RT-PCR. It is one of the most accurate laboratory methods for detecting, tracking, and studying the COVID-19 coronavirus. Okay, now we look at the dashboard, okay, by WHO. Okay, this one I got till 11 June 2020. There have been over 7 million confirmed cases of COVID-19, including over 400,000 deaths reported by WHO all over the world. So it shows us how this disease is dangerous and severe. Yeah. And this chart showing us the pattern of the confirmed cases over time. We can see that there are the increasing pattern of the viruses, confirmed cases, and the chart on the bottom, at the bottom, we can see the death over time, which is until 11 June, we have more than 400,000 deaths all over the world. And the figures, the numbers are still increasing. So it's very scary, right? Now, I'll show you the world dashboard of COVID-19 based on the region, okay? The highest region who got the confirmed cases are coming from America. They have over 3 million patients are infected by this virus, following by Europe, having over 2 million patients, and then Eastern Mediterranean, Southeast Asia, Western Pacific, and the least African region, okay, which they have just 150,000 patients, right? Okay, this is actually the distribution of COVID-19 cases according to date of confirmation by the Ministry of Health Malaysia, the case of Malaysia. Okay, to date, the pattern of new cases of COVID-19 are decreasing. However, because starting from 18 March, the government are imposing the movement control order, the MCO, for the 3 phase until it's extended to the conditional movement control order. And starting from the 9 June until 31st August 2020, the government eased the businesses. Most of the businesses are now can open, but the school and universities are still closed. And other activities as well, like the sports, most of them are already open, but with a very strict SOP. Yeah? Okay, this is the COVID-19 cases in Malaysia as at 11 June 2020. We have 2 new cases that day, and the confirmed cases so far we have over 8,000 cases with 118 deaths. Yeah? Okay, now how to cope ourselves with stress during the COVID-19 outbreak. Especially in the early MCO phase, many of the citizens are stressful. Yeah? The effects can be both physical and emotional. They cannot sleep, they cannot eat properly, they keep worrying, and their health is also dropped because they cannot, they having the panic attack about the COVID-19. So there are things that we can do in order to reduce the stress. For example, take breaks from listening, watching or reading about COVID-19 frequently, including in the social media. And then the second one, we can focus on the facts of COVID-19 and understand the risks to yourself and those close to us. Next, just separate the facts from rumors. We just gather information from reliable sources in our country. For example, in Malaysia, we have our Ministry of Health who give us the update daily regarding the COVID-19 cases. And also, we also have our Council for the National Security who update the SOPs what are the SOPs that the people or the citizens must follow in order to keep them fit and healthy. But if you if you feel that the stress continues, just talk to the doctor or someone that you trust. Okay. The picture on our right, okay, is a man exercising in his home because of the MCO, I guess. So just keep yourself in the best possible health, sleep well, eat healthy, and be physically active. Okay, now we'll see the potential of deep learning in detecting the COVID-19 symptoms. Dealing with coronavirus or COVID-19 is one of the major healthcare challenges around the world today. Especially at the beginning of the pandemic, many countries have insufficient test kits to test or screen for the COVID-19, and the frontliners are working 24/7 without any rest. So everybody are stressful. So the COVID-19 represents a new strain of coronavirus and presumably representing a mutation of other coronavirus. So the researchers are still studying about these viruses. In fact, we don't have any medicine to fight against this coronavirus. The existing infrastructure, for example, limited image data sources with expert level data set for the detection of COVID-19 positive patients is still insufficient. And the manual detection is time consuming because the health officers, they take the screening process one by one. And it is time consuming to get the actual result. With the increase in global incidence, it became imperative to develop and improve artificial intelligence method to improve the screening process and detection of COVID-19 in order to fight the pandemic. And this led to the development of deep learning-based solutions coupled with clinical practices to provide the cost-effective, accurate, and easily perform automated detection of COVID-19 and also to aid in the screening process. What the deep learning can do in this pandemic. So I'll show you some example case of Malaysia that we have actually, we've been developed these applications before and also within these durations of pandemic that we use the AI and machine learning. For example, the first applications that we have right now is the robotic technology. We have a pair of robots in our university, in UNIZA. The male robot is named Nasim and the female one is named Siba. And these robots are developed by MECA team from the Faculty of Informatics and Computing, also the Faculty of Innovative Design and Technology to do the hardware part. Okay, I'll show you some example of the robots. Okay, this photo is taken last year during our convocation. I think this one is Nasim. Okay, he gave a scroll to our one of top management on the stage. Okay, and another picture. Okay, now we have a pair of robots here, Nasim and Siba. Okay, actually, this is the simulation done by the university for a virtual convocation, for a possibility of virtual convocation, especially for those students who are still far away from Malaysia, who cannot attend the convocation ceremony. So these robots will represent those who cannot attend the convocation ceremony. Yeah. The second applications that we have, we call it CHASE. Yeah? It is COVID-19 Health Risk Assessment and Self-Evaluation System. Okay, in short, CHASE. This system is developed by researchers from the Faculty of Informatics and Computing and also Faculty of Medicine, UNISA. It is actually a joint project between UNISA and Ministry of Science, Technology and Innovation, Malaysia. This system is intended to be used for both UNISA staff and also community in Terengganu. Okay, I'll show you some pages of the screen of the system, of the CHASE system. Okay, this system actually is compulsory for all of our university staff to log in for every day to do the self-evaluation and also for the COVID-19 symptoms. Yeah. So as usual, if you are new to the system, you need to register first before you've been given a credentials or information to log in. Okay, and then you log in into the system and you'll see this page. It is self-monitoring page. They have two types of questions actually. Okay, just short questions, just in one page. Okay, like for example, in the past 14 days, have you attended in any gathering associated with COVID-19 outbreak or been in close contact or with the confirmed COVID-19 individuals? Okay, you must answer this question either yes or no. Like other questions, have you been travel to overseas in the past 14 days? And then the second type of questions are regarding the COVID-19 symptoms. Okay, are you currently experiencing those symptoms like fever, dry cough, sore throat, difficulty in breathing, fatigue, or muscle pain, headache, so on and so forth? After you answer all these questions, so they will evaluate your answer and they will give you the risk result. Either you are in a low risk, moderate risk, or the high risk. So this is my own case. Okay, luckily I have low risk in this time, and they provide they give you the result. Either you are low, so in my case it's low result. On our right side we can see some evaluations on the results. Either we can see there are a scale there, okay, with having green colors, orange colors, and red colors. Green means low risk, while orange medium or moderate, and red is high risk. Meaning that if you're having the red risk or the high risk, the system will instruct you to see a doctor or go to hospital immediately. Right? Okay, the third applications that we have now in our university in UNISA is Ask the Doctor at UNISA. This is actually a healthcare portal developed by a team of researchers from Faculty of Informatics and Computing, also from the Faculty of Medicine for the medical advisors. This portal actually is intended to assist the community in getting the fast response and advice of the symptoms they have without physically attend to the hospitals or clinics due to the pandemic. So you can easily get advices from our medical experts here. This is to avoid the congestions at the hospitals or clinics, especially at the beginning of the MCOs. Almost all the clinics and hospitals are full with patients. Either they want to screen for the COVID-19 or having other illness. So in order to avoid the exposure to the viruses or diseases during the pandemic. So this portal is developed to give the advices to the community of what to do if they have some sort of problems, health problems, and also the symptoms. Okay, this is some information about the Ask the Doctor in Malay. Okay, actually, this portal consists more than 40 experts, either in medical experts or in health science experts that will give you some advice on the dietetics and also nutrition. And if you have problems with any medical, any symptoms, any health problems, okay, you can, the system will direct you to the experts in medical or doctors to help you. But if you have problems in the food nutritions, diets, for example, the system will direct you to the experts in health sciences, our nutritionists and also dietitians. Okay, this is some of the medical experts that we have to assist you via this medium. The fourth application that we have currently is Ask the Academy at UNISA. Since the beginning of the pandemic, all universities and schools are closed. So that this portal actually, or this system, is intended to give advices about all academic matters to the students, because currently all the students either in universities or schools are sending home. Okay, this is the example of the page of the Ask the Academic. As usual, you need to register if you are new, and then after login, you are given an academic who can advise you based on your faculty. They divide between the science and technology and also social science category. If you are coming from social science faculty, they will give you an academics to answer all your questions relating to the academic matters coming from social science faculties. Like the example here, I just enroll myself into the system. I just log in. And since I'm coming from the science and technology category, they give me one academics that can answer my queries, okay, based on the faculty, which is science and technologies. Okay, now we will see the potential applications, okay, of the deep learning in order to fight the pandemic. Okay, I missed the deep learning there. Okay, the first one for the body temperature detection. Okay, high body temperature or fever, as we know, is one of the main symptoms of COVID-19. But unfortunately, it is done manually using the device on each of the patients. And this will lead to waste of time and possible infection due to the close contact with the infected patients, because these tests need to do one by one, and usually the distance are very close between the patients and also the possible patients and also the health officials or the doctors. So this giving the room for using the deep learning, which will be able to detect the body temperature using the infrared by the authorities within a safe distance. We know, we understand by now, hopefully, that the deep learning is a learning that they can learn bit by bit or categories by categories, starting from the low level categories until the high level categories. Okay, so there is some opportunity for the deep learning algorithm in to be able to detect from the mass, not one by one like we currently have nowadays. Okay, and this will save time a lot and avoid from getting infected. All right. Okay, the second idea is detection by pneumonia or lung infection. By using the lung images or X-rays, the deep learning algorithm will be able to effectively differentiate either the lung is healthy or infected due to the COVID-19 virus. Okay? And the third possible applications is detection of COVID-19 virus in the body. This can be done via the skin segmentation or detection through the image processing application. The deep learning can learn the skin abnormalities due to the virus. As mentioned by the WHO, discolorations of the finger and the toes, discolorations of the skin of the fingers and toes is also one of the symptoms of COVID-19. So by using the deep learning algorithm, this can be done because they learn by adding more hidden layers of the network in order to detect, to do the detection. Okay, the fourth idea is classification and detection of COVID-19 via the multiple symptoms. The COVID-19 has several symptoms and it's hard to differentiate between either you got a normal flu, normal cough, or a normal fever with the COVID-19 symptoms. So the deep learning can suggest the solution by learning deeper through the layers of knowledge and providing the best accuracy compared to the human evaluation. We also currently usually the doctors will use the lung X-rays in order to detect the abnormalities in the lung for possible COVID-19 detection. The fifth application is detecting the COVID-19 virus for asymptomatic patients. Positively infected COVID-19 have the symptoms. Some of them are asymptomatic, meaning that they don't have any symptoms whatsoever. So this is very dangerous because the patient will feel healthy, they are fit to do anything, going anywhere, meeting anybody without have any fear of being able to give the other patients or the other people infected. Okay, so the deep learning algorithm will be learned to identify the infected patient through the detections of the virus without any symptoms. So I think this one is important because the current trends, many patients which have been tested positive with COVID-19 are asymptomatic. So there are huge opportunity to use the deep learning algorithms in this pandemic. Okay, the sixth idea is to do the prediction of the pandemic. So the deep learning algorithm can predict the severity of COVID-19 cases by learning the patterns of infection. This can help in order to control or do the predictions on the new cases or the total number of the death. And this can be done by using the current data. Next, we can do screening for positive COVID-19. At present, as we all know, the screening process to detect the infected patients are done manually using a swab, which will be inserted into the very bottom of the nose and throat, and then sent to the lab for further analysis. And this process actually is very uncomfortable and sometimes painful and takes lengthy of time to test one by one and then have to wait for the lab results being analyzed in the lab. Sometimes the results will appear within 24 hours to 48 hours or maybe more. Okay. Okay, so it is hoped to increase the accuracy, save time, less close contact with the infected patients, and results can be obtained instantly. Last but not least, is detecting the COVID-19 recovered patients with still positive result in their body. Okay, the RT-PCR COVID-19 test will still show positive result for the recovered patient for a long time, according to Ministry of Health Malaysia. However, they are healthy and cannot spread the virus to the others. And study shows that it is due to the dead virus or the fragment of the dead virus which is still exists in the body of the recovered patients. So when they are discharged from the hospital ward, the virus are still in their body, but it cannot be spread to the other people. And by adopting the deep learning, it will be able to classify the dead virus from body compare to the active to ensure that the patient is fully recovered and healthy and he or she is fully safe to discharge from the ward. So this can be done by learning the features of the active virus and the dead virus. Okay, so these we can differentiate between the recovered patients, even though the virus are still there in their body, as they cannot spread the virus to the other people. Okay, as a wrap up, the rapid spread of COVID-19 epidemic has increased interest for the need of effort to develop an automated world speed COVID-19 screening and detection of an infected patients accurately. Deep learning has achieved state-of-the-art performance, similar to that of human experts in solving classification tasks in computer vision, such as lung disease classification, metastasis detection for breast cancer, skin lesion classification, identifying retinopathy, improving the recognition for MRI images, PET or CT scan images, so on and so forth. So a successful utilization of deep learning algorithm will better improve the diagnostic speed and developing novel, effective therapeutic approach. So like I said, there are rooms and a vast opportunity, a big opportunity to use the deep learning algorithm in order to fight this pandemic. And with that, I thank you all for watching and listening. Remember, we're still fighting the coronavirus. We are still far from safe. Stay home, stay safe, and take care. Thank you for listening.
Hello, thank you, Dr. Fatma. That was an amazing presentation. Thank you so much.
You're welcome. Hopefully everybody can
Yes,
understand.
thank you. Yes, sure, sure. Ma'am, is there anything that you would like to, any kind of tips or tricks that you would like to share with the attendees?
I think that's all. Yeah. But if you have any questions, you are feel free to ask. Even though now it's getting late here in Malaysia, it's
Okay,
getting
okay.
dark.
To all the attendees there, I would like to introduce to you United Innovators. If you haven't joined, this is a golden opportunity to join the United Innovators, which is a research and development service provider providing all the end-to-end services such as PhD thesis writing, research article writing with Scopus, Web of Science, SCI, and all kind of end-to-end PhD assistance and patent filing to the PhD scholars, academicians, and faculties. So if you're interested, you may go and click on it and you can apply for the benefits. This is truly a golden opportunity for all the research scholars. This is a great platform providing all the assistance. I have shared the link right on top, so you can try them, click on it and apply for it right now. They are the United Innovators. We will be we'll be joined by Dr. Singham in a while. With a busy schedule, he was unable to join us. So kindly be patient and be with us. And you may also ask us any query for all the attendees there. If you have any kind of information that you would like to hear from our speaker, Dr. Fatima, kindly write to us on our chat box. We will be replying to you. Dr. Fatima, your video is off.
Yes.
Your audio is clear, but unfortunately, your video is not seen.
You want me to on the video again?
Yes, our you can answer to our attendees who have joined us.
All right.
Yes, thank you so much. Yes, attendees who are still watching us, you can speak to Dr. Fatima. Kindly let us know your questions in our chat box.
No questions, I suppose.
I think all are interested in getting your presentations. With your permission, can we share to the attendees your presentation?
Yeah, sure. Still no questions? I think maybe everybody is,
Okay, thank you
understand everything.
so much.
You're
So all the
welcome.
attendees there, you can write to us. Yes, you can write to us on.
Oh, there is questions to share the PowerPoint slide.
Yes.
You may share the
So they can
PowerPoint
write
slide.
to us on webinar@ifprp.in. Your queries or us. Attendees can write an email to us. Whoever is interested in having the presentations, we'll surely share it to you via email.
Yeah?
Yes.
So I think maybe just No questions? That's all?
Yes, we'll just wait for the next speaker. Meanwhile, maybe you can instruct or guide our attendees related to AI. Maybe you can share with them your expertise, anything. Maybe how you had done those robotics virtual convocation, which was very interesting to see.
Actually, the university is still deciding on, using the robots to represent the students during the convocation. This is due to the pandemic, so that all the students are sending homes, the universities are closing. So the idea is to do the virtual convocation ceremony by using the robots, and the robots will represent the students who cannot attend the convocation ceremony. Like I said, we have two robots, the male and female robots. So the male robots will represent the male students, I suppose, and the female robots will represent the female students. So I think that's a good idea, but I'm not sure the decision of the university, either they will impose it to this year's convocation or not.
So,
Right?
what are the
And
drawbacks in virtual convocation? Like all the innovations or anything that we implement, it will always have merits and demerits. So, what are the difficulty that you found in virtual convocation using the robotics?
actually, it's just like the symbol, I guess, so that the students cannot attend. But the idea is like maybe when the situations permits, the students can go to the universities, enter in the hall. But there are maybe some of other students who are still away the country, who cannot come here due to the pandemics. So, but I guess from the feedback, some of the students are opposed to this idea, because the convocation is like, you want yourself on the stage or be happy, with the scroll, you need to,
Yes, once in a life
get the
moment.
scroll once in a moment, really. So some of the students are opposing this idea. Some of them, are anxious to see the new ideas like this. Okay, maybe I
Yes,
will
yes.
talk some of my a little bit about my experience. Okay, my PhD in computer science. I specializing specializing in pattern recognition, and that time I focused my study on the statistical pattern recognition. So a lot of statistical measures like distance measures to differentiate things, classify things, recognize things. And then, but currently, some of my students, my PhD students, and my research directions are more on the biometrics pattern recognition. We are developing some biometrics systems, and we try to solve some of the tricks problems, and also adopting the deep learning to detect the face, like what we have in this pandemic. You need to ensure that you get yourself in the safe distance, so that you are not expose yourself to the possible positive COVID-19 patients. So I think this is very important, and there are actually a lot of opportunities to do the deep learning. And if you want to know more about my specialization, what I do, or my postgraduate students do, please feel free to ask me. Or if you wish to be my students, masters and PhD students, welcome.
Oh, that's great.
Yeah, I think
I'm sure there'll be
you
many who will be interested in.
but you can only come here to Malaysia after the pandemic's over. Otherwise, because the
Sure,
borders are
sure.
still closed. I think Dr.
Oh,
Singham
I
is
see.
already here.
Okay, okay. Yes,
Yes,
I
madam.
think Dr. Singham is
I
joining
hear.
us. Hello, sir. Good evening.
Yes, madam. Yes, madam. That
So
madam's
your
presentation
video
is
is
over,
off, sir.
madam. Yeah, yeah. Right, just now our other presentation is finished. Just
Okay,
2 minutes before.
okay.
just 2
Okay,
minutes
thank you
before.
so much. I know it's a busy schedule for you,
It's
so
okay,
all
madam.
our attendees are waiting for you, and they are also watching you live on YouTube also.
Oh,
So
I
can you
see.
please switch on your video, sir,
Acha, shall
so
I?
that our attendees can see?
Acha,
Yes.
acha, madam. Okay. So same thing. I have to open.
Yes. Good evening, sir. Welcome,
Very
welcome
good
to our
evening, madam.
webinar. Yes, Dr. Fatima has just finished her presentation.
Acha, acha. Namaste,
Yes,
Fatima, madam. Namaste.
meeting you.
So we were just having a discussion on it
Okay,
and
maybe I
waiting for
should.
you to join.
So now I will start sharing it.
Yeah, before we
So
start, I will
yeah,
introduce our attendees once again, Dr. Singham, sir.
okay, madam.
Maybe I should off my video now. Yeah?
Yes, yes. No problem. We'll just introduce her to our attendees.
All right.
And before, yes, so all our attendees as introduced before, I'm reintroducing to you Dr. Singham Jayantu, for whom we have been waiting from a long time. So he's a busy person who is attending and delivering keynote speeches at various webinars. So that's the reason he was late for our webinar too. So thank you so much, sir, for joining us today. It's a great honor to have you here and spend your valuable time with us too and share your expertise. So can you please welcome our attendees who are watching us live today?
Okay,
Just few
madam.
words, maybe you can speak to our attendees.
Very good evening. Very good evening to all our beloved participants. Now, this is a wonderful occasion, and at the outset, I congratulate all the participants, and I thank our organizers for giving me this opportunity to be a part of this webinar. And this is such a situation where our total world, I should say, universe, total world is shaken, I should say in that way. Now, although there are so many new suggestions from who means World Health Organization, are also coming, and they are also under confusion, I should say, based on the recent messages. I was not going through all these details before, but after within these 2-3 days, I tried to go through all what is happening as far as COVID-19 is concerned, and with that little bit of minimum exposure, along with my co-speaker Singham Jayadarshana, who is working in Center of Excellence, that is in Artificial Intelligence in our CET, College of Engineering and Technology, Bhubaneswar. So I tried to collect some more information and try to talk something about these. I could have gone through some of the slides by our previous speaker. It would have been more useful for me had I attended her speech also, but little bit I could able to see in between just while presenting my presentation with our MGMI and other group. I was seeing in between like that. Okay, madam. Now I think with this little bit of background about COVID-19, I would like to say, sharing some our slides. I am just trying to share our
Sure, sir.
slide. Yes, madam. I think yesterday uh, uh, our Mustafa madam trained us well in sharing the slides. I hope I can do it within no time. But the computer is not in our hands. Maybe that connectivity and all. A goal gomra either. You get connected, sharing that. While that gets opened, before that, I would like to say something more. And as far as this artificial intelligence or basically our CSIR, say when it comes to Indian Department of Science and Technology, we call as a Center for Scientific and Industrial Research. Since I was a part of it over 2 decades as a scientist, so that effect is there with me, where we promote transdisciplinary research and translational research. So here, for the benefit of our scholars, I hope some scholars may be there as a participants here and some faculties, maybe in India, other places also, that may be useful, where this type of transdisciplinary research and translational research, we have kept it in the vision of our document itself. And I think now it is taking some more time for sharing it. Still that is happening in the slide. Let me also try and say something. Now, are you able to see something, madam? Share slide. I'm trying
not yet, sir.
Not yet, right? I'm trying once again. I think this should. I mean, I should stop slide and then again share, I think. I have to do like that. Yeah,
Yes.
I'm stopping it again. I stopped it now. Again, I will share it. Okay. Already it is there, madam. I think.
Yeah, sure. Then you can play it. You can play it.
Let me see. Yesterday also this type of experience was there. Let me see now. I am making it start. Let me see whether it is that one or previous one. No, this was your slide. But my slides, what is supposed to be shown, I think I should go down and add a new presentation. I should make it, it seems. Again.
Because maybe because of poor network issue also it takes time in uploading.
Yes, maybe that way. Achha, meanwhile, may I know participants belongs to what background, so that makes me more conversant with and where I can give more.
IFERP members are across the globe, sir.
Right, madam. I mean from computer science background, electronics background. This is my interest is that. So I'm trying to see from here our presentations. Let me just see. It should not take much time. Let me open it, madam. Now uploading. I am uploading once again.
Fine,
I think you are also able to see something is happening. Uploading, I think. Meanwhile, when it comes to this transdisciplinary translation research, so we have PhD scholars from different background, maybe computer science, electronics, instrumentation, and then they are working specially in mining industries. Nowadays, you must have seen mining industry also is declared nowadays as emergency service. That's why during this COVID-19 period, although many activities were discontinued and stopped, but mining activity government has given declaring it as emergency service. In that view also we have been doing a lot of work. Of course, those mining related things I will not talk here. That may be boring to others. But
still you can speak a few words about it, maybe.
Definitely, madam.
Still, because that is your specialization.
It gets opened, I will do that. When it opens, then I will talk about it. I think now it is getting opened. Now I am just starting this. Yes. Now you see, madam. Now it is okay.
Yes. We can
basically. Okay. Then.
And by the way, I would also like to thank Darshana, who has helped us from yesterday in putting out all the experts and awareness to our participants who have joined us today. I know there's a lot of effort of Darshana too. So thank you so much to Darshana.
Thank you, madam. She is also here helping me.
Yes.
She will also talk something because since she is working,
this is her, yes, I know
doing a lot of dedicated work in that center of excellence. She can also share her experiences, especially she is designing that chartport and all, so many other
Oh, that's so
experiences
nice.
she will be. Of
Sure,
course, whenever
sure.
there are some doubts also, she can also take up in that way.
Sure, sure.
So now going ahead, I think,
Yeah, sure, sure.
shall I make it full
You can,
screen,
yes,
ma'am?
yes,
This is
sir. You
all right.
can begin it. Yes,
Sure, I can begin, right? Okay.
yes, sir.
So now, namaste to everybody, our beloved participants, including faculty and scholars, those who are really interested in the present day situations. I mean, any research for that matter. And also, our IFERP is dedicated to develop our next generations. As I have been involved over few years as a member of that team in conducting various international events. With that also, on behalf of IFERP also, I welcome all the participants and on my behalf and my co-speaker, Singham Jayadarshana, who has put all these efforts to compile. I may be talking something about it, but she is expert in this Center of Excellence in Artificial Intelligence over a few months or about a year. This is a recently established center in our state with this aim specifically. So that's why I felt very happy when I was asked, I was requested by our Pooja madam and Mustafa madam that can we deliver a talk. Then readily accepted our co-speaker, accepted and prepared all these. And she'll be taking it a privilege to answer if there are any queries with her experiences. So before that, now I am continuing with saying something about what are these applications of our artificial intelligence for awareness of COVID-19. And here I should say, when you might have done a lot of research and you might have created so much database, and this may be related to anything. Now I am generalizing it as a scientist. So you have done wonderful research, for example, and you have given a lot of data, equations, modeling, so many things. But unless you create proper awareness to the people at grassroots level, I will say, who are the actual persons who are supposed to utilize that data, utilize that results of that research, unless that result or that science is made are taken to those grassroots level, that is useless. So this is what our well-known scientists, including Newton or Einstein, whatever. And again, it is not only taking that every research to those persons, and proper utilization is also very important. And here, when I use the word artificial intelligence, nowadays, many people have taken this as a buzzword. Whenever they say, even I have so many scholars, PhD scholars and all, coming with so many types of proposals to apply this and that and so many ways, unless they understood properly the problem, that is a field or the actual societal problem, there is no question of applying any artificial intelligence or anything. You may be expert in artificial, you may be a gem in that, but unless you understand and unless your intention, I mean, I'm showing the brain, unless your intention is to help our society and create that awareness, that is useless. That research also useless, and that may lead to disastrous and dangerous effects like a research and leading to E is equal to mc square, used for producing power, nuclear power, but at the same time that was misused for generating or using as a bomb, nuclear bomb. So same thing in artificial intelligence. What I could see with my limited exposure and my scholars working in these areas, unless it is properly utilized, used, understanding the problem, they become a useless tool, and unless it is tested, verified, right, and calibrated, I should use that words, more proper words as an instrumentation engineer. Also, I can say in that way, using so many safety related works, conducting more than 100 projects involving dangerous situations in the mines. I can say my experiences later. But now continuing with this, now when you see, now I am going further to the next slides. Then here I made a simple outline so that it should not be a repetition of what Dr. Fatma has already. She devoted a lot of time, and some of the slides I could see, wonderful slides she prepared, and from Malaysia she tried to tell in a very sweet voice, nicely, so it should not be a repetition. So that's why we try to make it with little less chance of any repetition in that way. So COVID-19 and its current situation, yes, we try to say something, and then role of technology towards the pandemic. Right nowadays, when you write simply in a Google, you will see lot of data. This explosion of data, and some of my scholars are also working in different institutions throughout India, whether they belong to biomedical department, computer science, electronics, instrumentation, like that. So we have a team of this transdisciplinary research group, specifically from Adams University, Kolkata, Centurion University, Bhubaneswar, CET, Bhubaneswar. Like that, there are so many institutions in different states, Telangana and other states. Here, later, role of artificial intelligence towards the pandemic. My co-speaker, she will be explaining further that issues and key solutions with her experiences of how they developed their center of excellence, and how they could meet their expectations of our state as far as creating awareness through this artificial intelligence and center of excellence. She will be talking about later two parts of it. So just I will say something about only first farmer to this COVID-19 and its current situation, as well as role of technology towards that. And here, when you see, as far as COVID-19 is concerned, I need not say this Fatma madam already said many things about this. And only thing is, I can just show maybe a like a old wine in new bottle, something like that. When you see in a hand, now you are able to see here coronavirus in hand. So don't go by this Australia or whatever figure is there in the globe. This is there throughout the globe, all around. And this is everybody knows this is a coronavirus disease, and this name is caused by a newly discovered coronavirus. And this is more related to respiratory issues. And here I should tell at least, because there are so many approaches people are working as a solution to this. And at least with the inspiration of our Honorable beloved Prime Minister of India, Honorable Narendra Modi ji, I can say being associated over 2-3 decades with all these yoga practices, because I have one Utkal Yoga and Naturopathy Center. I'm a trustee member for that. Through Ayush, we designed so many things, and even homeopathy and other, they have done a lot of things. But how to collate all these data, how to collect all these data, and when you collect all these data, how to compile, and then how to present in the form which may be useful for when you collected the data throughout the world, throughout the globe, as I have shown here, when you collected it, then how to categorize that data and how to compile and present and get all this information to the people where it is required. So there comes the issues of utilization of these latest technologies. I put in a general way, as we used to put it over 2-3 decades. That word has been a buzzword, I should say. ICT, that is information and communication technologies, where all these issues, I hope it will come into that. And this definitely helped a lot. And here, when I go a little bit further into these aspects, now I can say something more. Now you see, this is, I think, the yesterday data. My co-speaker has given this wonderful data. Total, you see how much is the cases and how many in the dashboard. You can see here 1.36 lakhs, and here you can see about 4.23 lakh death cases are there. And these coronavirus cases throughout the world, when you see here, this data shows. And all this data, how people could collect, again, that goes to the to this, whether it is artificial intelligence, computerization, or digitization, or digital world, all those things are helping us to even collect, categorize. All those things are very much important for us. So in that way, we try to collect. This shows this many deaths and this many new cases. This is whatever is there on the top. This is a new case, that is 1.36 lakhs 572, right? So now here we can see when we go little bit forward, as I was trying to say something more, where Fatma Madam already explained many things about the role of technology, and there comes so much of machine learning, and then using these by, I have my co-investigators in different projects, where from biomedical department, they have been doing a lot of work, and where even detection of coronavirus. So my co-investigators from physics department, even like X-rays, collecting all the data throughout the world, and then utilizing even not only X-ray, this is a T-ray, that is a one step ahead, gamma ray and all. So that type of data also people try to utilize it. So all those things people are doing nowadays. And in that way, this platform of artificial intelligence, and where a part of it comes, as Fatma Madam also explained many things about deep learning and all. So here, these buzzwords like machine learning, big data, those are given here. So where this type of information has been used in different projects, where it comes to artificial intelligence, where this is contributing to fight the COVID-19 pandemic projects. That is, they are directly related. That is directly related to pharmacology, even medical and hospital care, and mobility analysis, even to reduce this contagious, and have found to play the crucial role in this, and then making some more progress in the science. So to start with, any data, the data, more data gives more confusion to the scientists and to the investigators, to the scholars, and unless it is properly analyzed, and that platform is made available through this artificial intelligence. You may call so many names in that, whether it is machine learning, deep learning, artificial neural networks, and so many things like that. And here, now going further, when you see, so about this artificial intelligence, and my co-speaker, she will be talking in more details about this, and later we can take up the queries. Now I am handing over to my co-speaker, Ms. Singham Jayadarshana. She is working actively in development of Center of Excellence in Artificial Intelligence in our state. At present, they are totally dedicated for development of even chatbot and so many things. So she will be explaining even our experiences also, depending on the interest of our participants here. So now over to Ms. Singham Jayadarshana, please.
So good evening, one and all present over here. Thank you, sir. Now I'd like to continue from this part where the artificial intelligence begin. So firstly, yeah, am I audible?
Darshana, please continue. You're audible.
Okay, sure. Thank you. So, firstly, so before going to tell or discuss about the solutions or regarding how AI has helped in this pandemic, I'd like to give a brief and a short knowledge on what AI is actually and how it is being useful. So, in a very simple words, I'd like to explain this not without too many technical stuff. So basically, AI is nothing but this is a technique where algorithms are being used, and these are programmed to a device or any machine, so that the device or the machine starts behaving in such a way like a human brain. So, for example, we might have heard of self-driving cars, or we would have played chess or some games in our mobile applications daily. So these are few examples, and even chatbots. These are like a basic thing. They may look basic, but uh, at the back end, so many AI processing is being done there. So these are like every day we use Ali or Siri or OK Google. You know, these all are the voice platforms of chatbots. These are few of the examples. So these are the key benefits of artificial intelligence. So, mainly, they provide 24/7 help to us, and any task it is, they help in recognition or planning. Mainly, they're used for planning. And definitely, to a company or an organization, multitasking is being hard, and for a human like us, we can't multitask or everything. So here the main role of this AI comes, and it eases the workload of the existing resources. So here are a few of the key benefits of artificial intelligence, as it is being seen in the slide. So we can say it is a smarter way where we can reduce the human work or the workload. So next, these are few of the major industries where AI applications are being tremendously increased in the application way or the usage way. So a few of them are here, like healthcare, retail and e-commerce, food technology, banking and financial services, logistics, transportation, real estate, manufacturing, entertainment, and advertisement. So many companies in their own way again. Like for healthcare, for example, I'll just take two, three of these industries and just tell how AI is being implemented there. So for healthcare, suppose many of the apps are being made. For example, Apollo is an great organization. So these Apollo apps are being made where different they're giving a 24/7 service to the patient or the new users or the people or the public like us. Like we can just query them about anything at the midnight 2 a.m. to ask about our query, like if any problem is there or something. So health, even the medical stores, they have their own applications for keeping a proper track on which people want which kind of medicals or how they can be distributed. Or for example, food technology. So I think everyone are very familiar with the Domino's apps or many other apps. So whole this tracking process, they may look simple, but in the back end, so much work has been going on. Like Python, basically, previously the websites are and applications have been made through scratch, like using .NET or Visual Studio and all. But now, what happens is in the front end, they design it with .NET and CSS or C# languages, but at the back end, the Python is being running there, where in which the code is basically a deep learning or an AI code. So basically this is how all these apps and websites are being designed using AI and deep learning methods. Same in traveling also, most of us are familiar with Make My Trip apps or Go Ibibo, Oyo, everything. Every app has same thing. At the backend, Python, which involves AI or deep learning algorithms, which is being trained. So yeah, so these are the key solutions that are provided by the AI techniques. So as I said, planning, for example, I can tell you that if suppose we are placing an placing a application which is used for face detection or fingerprint detection, which is there everywhere in the public places. There what happens is they already give thousands and lakhs of previous data of different people to in the algorithm, and they train the model so many times with new models and all. They train in such a way that the model takes some time to understand that okay, this is the process now, or okay, now this is how I should behave, or this is how I should uh, task now. So basically this is how AI provides its solution. And better communicator, of course, like nowadays almost all any application, any shopping application or restaurant or any applications, they are being replaced from the what do you say the the people who sit and just from call centers, right? Sorry, from call centers, all are replaced using chatbots nowadays, so that any person can just talk in a voice form or in a textual form. In both ways it is great to use. So as a better communicator, it is a solution that is being given by an AI, that is an AI technique. And perceptions, even perception, it is same like a planning thing. And mainly it is used for decision making also. It is in the same way, but using different algorithms and all. It is used to just work like our brain, and it is used even for mainly it is used for predicting and enabling quicker response to a disaster. For example, in hilly areas or somewhere, if there is a small shake, or there is some roof fall or side fall, anything. So before end, according to the statistics, the sensors are being trained in such a way, and they are interfaced with that whole AI system, so that the user like us sitting in front of our laptops, we get an indication that the fall or any fall might happen in between this time or something, so that we can take a precaution, which is very important. Saving different lives is also uh, very important, and it is done by AI technique. So yeah. So coming to this COVID-19, so we have now got an overview how AI has been, used in different industries in different ways. So coming to COVID-19, I think many of everyone, we know what is the present situation. So how these AI techniques are being, you know, playing a role to help in this pandemic, towards this pandemic. So firstly, few of them are listed there in the, in this. So chatbots are one of them, and representation of data of present scenario of COVID-19, the data dashboards, social distancing check in public places. So these are mainly used by police systems and the different government organizations, and COVID tracing applications. So few apps which used to trace this coronavirus thing, and face detection. So these are few of the AI solution. Face detection, again, I think when we go out nowadays, it is very important to wear a mask. And in a few places, there is a system of face detection, recognizing the face instead of giving a fingerprint or anything. Now I think even in airports, they have placed a face detection with a mask, so that a person cannot get exposed to this environment. So this is how, these are the few solutions of AI, how these are useful now and then. So yeah, so again, so the major sectors which are using AI techniques in a current situation. So virus research and development centers, these are using these techniques. Health centers and hospitals, public places, police and security agencies. So mainly these are mainly used by these sectors today. And why they are used, of course, the same thing, to validate the models of existing systems, improve fairness of the data, and improve the confidence in recommendation system. Definitely, when a word confidence is coming, so definitely we shouldn't even believe in any of the application or any of the news that is being forwarded to us through WhatsApp, or that is being shown us to any application. No, we have to know that yes, that is a trustworthy site or trustworthy thing. So how we'll be knowing it? So there again, there is a thing called fake detection, fake detection of news. So there we there again, another algorithms, again the technical stuff goes on. But here we also get to know that yeah, this is fake or this is real. So yeah, this is these are the major sectors and how they are being useful. So now I'd like to just say a few of the examples that are being majorly used in this situation currently by almost every organization, every government agency, or any private agencies also, so few of the institutions, everyone. This is just a picture that I have taken from the Google, where I just typed data dashboards of current COVID situations, and I got so many. So I just thought to just put that pic, because here we can see so many of them are, so many organizations have put up their own things, and all thanks to GitHub, sites like GitHub. Because even to an unknown person, like even me, I think before a few months, like 4 to 5 months, I just started knowing what is AI, or I started working I got an hands-on knowledge on Python and all before 3 to 4 months. Before that, I am an alien to this subject, as my background is electronics and communication and electronics and instrumentation. Now I'm doing masters. But even any, like, just if you have an interest, you definitely have to go and check out this GitHub site, where all the people who have worked in all such, making dashboards or chatbots or anything related to COVID, mainly anything is available there. But if someone wants to contribute to the society or to the place they are, and there are no sources, so they should, I think, definitely check into GitHub site and search, and then get codes, algorithms, and then implement it in Python. And then I think even the errors can be checked nowadays easily using Google. And so in that way, anyone can just try it with basic things, taking basic details from these sites. So this is data dashboards are one of the example where we get different statistics of the present situation day by day, hourly. We get how all the datas are being done, are being analyzed, everything we get it in live. So this is one of the example, an AI technique. And similarly, virus tracking applications. So here in India, Arogya Setu is one of the application that is authorized by the Indian government, where the following are being done. Like here, it alerts the users. It is totally a Bluetooth based, again, where Python is running at the back, of course. So here, what it does is it basically alerts the users. Whenever a user is exposed to a place where the people are already there with the proximity, or infected people are already there, so it just it tells us that not to be there. And it asks, firstly it takes our whole like information about us, what is the current situation, what are we facing from, what is uh, actually going, where have we traveled from, or where are we traveling to, everything. The app asks everything, and accordingly the we get a data sheet that should we are we exposed to that play are we exposed to COVID symptoms, or what is our present status, everything we get in this app. And this analyzation, the thing which is going in, that is all done by machine learning and deep learning, the algorithms. So this is the part where basically an AI is being done. So coming to the next example, social distancing techniques. This is the major requirement nowadays. I think it is not fully fledged now, like it is not fully used, but uh, as I am an intern of COE, that is Center of Excellence in Bhubaneswar, so we are just now trying to build such solutions where in a public place, if from this figure again you can notice that the people who are distance far apart till 6 feet or something, there the green detection thing is being green square box detection thing is being shown. But the people who are beside to each other, are very close apart, nearly 2 feet apart distance, like that, I think we can see the red indication, which is an emergency thing. So basically these are being done by the surveillance cameras that are being attached to every society or every street. One camera has been attached, and these are being maintained and observed by the police and different police organizations or agencies. So this is a model that is developed by a AI technique that is basically here. Not only it detects the people, but it is also, we are also trying to detect the cars in the similar way, the cars or the vehicles, so that they maintain a certain distance in the public. So this is the current thing. Few of our states have already they have developed it, and they are maintaining it. But in our state, like it's Orissa in India, so we're still going through all these things, and we're still in the development part. It is working, but it is not a full-fledged, a few errors have been there, so still we are working on it. So this is one of the technique. So next, similarly, the next one is the chatbot. So as discussed before, so here at the different, in the slide you can see how the chatbots are being used. So but in this pandemic, how chatbots are taking a major role, this is a basic but a very major role, trust me, because here in this in this image, I think there is a language, an unknown language, that is basically Telugu. So here in India, every state or every organization also have developed their own chatbots in their own languages, using NLP, that is natural language processing. they have developed it in different languages, almost in all languages, and so that the public, because I think we who are literate, we can read English, we can understand them, but to the people, the local people who don't know how to read English, or who can't understand it, for them these lingual uh, these chatbots which are being made with the local language, it is very useful to them, it is very handy to them, because now everybody are alert, everybody know that what is the situation or what the precautions should be taken, everything about health centers or about diagnosis, everything is being given in these chatbots in their own languages. So this is how these chatbots are being used. So these are the few examples that we are been working on as an intern in our COE lab. So that's why I've just presented them. So thank you. So if you all are interested, then I can just share the screen and show the website of our COE lab. If you all are interested, I can just share it and show what we have made.
Yes, sure, Darshana. That would be very kind of you. You can
Okay,
surely share. That will be very informative. Please proceed.
yeah, thank you. So I'm just turning on the
How
screen.
Yeah,
much
you
more
can.
time we can take, madam? How much more time?
Yes, we have another 20 minutes.
Okay, madam. Right. Okay.
Can I just know, is it visible or not?
Yes, it's visible.
Yeah, so basically, this is a website that we have made using AI techniques again. So here, where I'd like to tell what we have done to this COVID-19 thing. So as we are in Orissa state, and we as an interns, we are working to this Orissa state organization. We have made it completely in both languages, English and Oriya, so that even the local people can get it. So here, even I'm sorry, even because even I don't know Odia, how to read and write or speak correctly, because I'm basically from Telangana. So here, but still. Here, see, district-wise Odisha activity cases, you know, here. So here we can see that in Odisha, how district-wise, active cases and all, and the red part here. So here it is the red zone. That's why it is showing that way. So here again, age-wise affected percentage in India. So here also, here we can see how the different age groups are being affected. So green, orange, here at the side we can, I think in the side here we can see age group, how all these are being grabbed. So here are the affected cases district wise. So here is the positive sample defected data wise, how what are the what are the cases, positive cases, all these are there. I think it is not updated yet, or maybe the people are still working uploading in it now. That's why it is showing till 27th April. Otherwise every day it has been updated. I think between this time they just update it or something. So yeah, here are the, you can see the sample tested data wise, or state wise status in India. So here are the active cases country wise, world data. Like you just need to, select one thing, and we get the status, what is it. All these are developed by our interns. Everything is produced from our lab, using purely AI and deep learning, all these algorithms and techniques. So here, for example, in India, it is showing that the total tests are, uh, 1,17,339 total, everything, accordingly, all are being shown. Even the death cases country wise, you just have to select it, total deaths 423 in India, China 3,342. So many are being shown. So these are the confirmed cases. So again, here we have placed a chat bot. You can just look over it, which is totally made in Odia, for the local people. Because in English, almost all organizations have made it, like WHO or Apollo, all medical organizations have made everything. So we have tried to, build a chat bot, which is in the local language so that it is served to all people. So here it is totally in Odia. So for example, if I just click on COVID-19, you know, so we get brief description on it. Similarly, similarly, the medical facilities where, we get what hospitals are being or what medical centers are there in the total state, we have listed it. For example, the Capital Hospital in Bhubaneswar or AIMS in Bhubaneswar, SCB Medical College, similarly, we have just developed it so that including all the information that is necessary for a state people to know. So almost everything we have listed almost the basic requirements, and yeah, this is the site. So thank you. So yeah, thank you.
Voice is not coming, madam. Voice is
Can you
not
hear me
clear.
now?
Audible.
Yeah,
Now it
Rashna?
is audible.
Yes,
Now
yes.
it is.
Thank you so much. That was very kind of you and very informative. So I would like to ask you for an advice as an upcoming researcher for the audience who are the attendees who are watching us from across the globe. What would you like to advise them with in this AI? Because you're an expert in it and you are doing a lot of government projects as well.
Uh, yeah, actually, what I'd like to give an advice, like nothing much, just everyone. I think everyone as an individual who who at least I think majorly engineers or any tech person, I think should come forward and try to give something to their society or to the place they live with few of using few of these techniques. If they feel it useful, I think everyone should just give it a try to at least do it. And of course safety is the major thing. So yeah.
Okay. And is there any kind of merits or demerits that you can give us in short?
Sure. Regarding artificial intelligence,
Yes.
yeah, definitely. Again, AI, it has so many, we have seen what are all the benefits and all. So coming to the demerit part, of course, like here mainly if these NLP, natural language processing, and at the back end, so many techniques are there, even nowadays, even since robots are being, like even I don't know much in detail, but just telling like they're trying to you know uh, provide a few with few algorithms and all, with few databases of our human behavior. They're trying to integrate in robots or any devices or machines. So this is good, definitely, but again, the utilization, if it is in a wrong way, definitely a person, it depends on a person again. So if a person uses it in a right way, then it is definitely beneficial in a very large way. It will impact it. But again, if it is utilized in a wrong way, then it may get into wrong hands, and it is very dangerous. Then it would be very dangerous. So
Here I would like to add something more, madam.
Yeah, sure,
As
sure,
you
sir.
asked a right question, you must have watched our Robo movie by Rajnikant. So there, that is nothing but artificial intelligence and other techniques which were integrated into that robot. And you have seen the wonderful use and then worst and dangerous and disastrous way of utilization of it. So that's why in the beginning, I tried to tell you, depending on its utility, as our co-speaker also said rightly. So that is more important. And one more thing is, nowadays, since there is a requirement of distancing and not to, even while taking the reports from the patients also, nowadays there are so many gadgets, I should put it in this way. Gadget, that means even your watch, or it can work as so many things. Even it can measure your total health condition also. And that data can be sent to different people. It can be to your parents, to your relatives, to the doctors. So like that, in when I was trying to see its applications in COVID-19 issue, I have seen hundreds of uses. I cannot explain all here, but since you asked about this, so I can say a little bit about few things as far as COVID-19 and artificial intelligence and other uses are concerned, which I could not put it because of some time. I have another PPT also. If time permits, I can also show that, where we have given there. Now you see, now a doctor cannot go to the patient. Now there also we are using this artificial intelligence, even taking the reports, even that data, if a patient is talking about it, converting into the voice to text, and then giving the reports, and then like that, even face recognition and also many things. Already our co-speaker and Fatma madam also might have said so many advantages of it. Madam may say something about it. But recently what we could see, even through my own friends in medical field, we have our people in doctors and other people. So where that data, getting the data and giving the data, even all these, how it is being compiled, and then using this artificial intelligence to understand that trend, all those things are being used. If there is some time, I can show another PPT is also there with us. But meanwhile, we give more time for discussion, madam, depending on any queries or like that. Yes, madam.
Yes, our time permits us very little. So we'll wrap up with a few question and answer session. Dr. Fatima has also joined us. So we have a query here asking what is the safe number of reasonable data to use in machine learning? Is there any safe number of data that can be used in machine learning?
As far as our, I will say a little bit about it, and later my co-speaker may give her whatever they were using. Basically, this is as far as some statistics are concerned. So always, whenever you are conducting, because I have been involved in prediction and giving warning based on the data in many excavations. Suppose I can give you a simple example, where now you see a fall of a slope or a hill. So that is happening, and it is burying so many cities or so many people under that. And there, now we have been monitoring with so many sensors. Here, those issues I are not told here now. So many sensors, and there, when there are more sensors and more data, then your prediction, so that will be more realistic, right, madam? And there, when it comes to the count number, so I think in statistics there may be something showing some significance at this much level of significance. This is the prediction level and all those things. But on that, Fatma madam also may be able to say something more.
Yes,
But as far as
Dr. Fatima, what is your opinion?
Thank you. Actually, okay, when we train the data, we cannot be sure, okay, the exact number, because the training is keep on and on until we get the very best of results. So it's really depending on how you do the experiments, and because you need to make sure that you do the optimization so that you can get the best of the result. So it's really no answer for that. I'm sorry, unless you do
Okay.
the experiments and you know it yourself. Yeah.
Okay. So I hope the attendee has received the answer from our speakers. And thank you so much. So Dr. Fatima, before we wind up, would you like to speak a few words to our attendees who have joined us today for the vote of thanks, maybe?
Okay. First of all, I would like to thank you for the IFERP for giving me this opportunity. Also, Dr. Singham, nice meeting you.
Namaste,
And
madam.
yeah, namaste to you too. Okay, and I hope you got some idea. Actually, I don't since we don't have time to go deeper on each of the session. Either it's starting from the artificial intelligence, machine learning, and also the deep learning. When I browse back the questions from all of you, some of you are mentioning something like, very deeper questions. And but I think if you have any queries, any further queries, you can always email me at my email, fatma@uniza.edu.my. So I will be able to answer you. And I think some of you also private message me to become my master's and PhD students. So
Yes, so all those interested,
some of
you
them
can write an email to Dr.
just
Fatima.
contact me, really. So I think that's all from me. Again, I thank all of you for listening and watching. Until we meet again.
Thank you so much. Thank you so much, Dr. Fatima, for joining us today. Dr. Singham and Ms. Darshana, who has joined us today. Thank you, both of you, for sharing your expertise. Oh, I think they have lost the connection.
Oh.
Okay, so all our attendees who are, yes.
If you still have, any of the participants, any of the listeners still have some questions, you may ask me here before this session ends.
Yeah, sure.
I don't know how much time we have.
Yes, we will be winding up in another 5 minutes. So before we wind up, I would like to remind all our attendees regarding United Innovators. You can browse on it. I have shared the link with you all, who is the research and development service provider, providing all the end-to-end services for PhD assistants to the PhD scholars, academicians, and faculties. So you can go and apply for it right now without wasting even a moment. So this is a great opportunity for all those scholars right there. So I have given the link. Please go browse and apply on United Innovators right now. Dr. Singham, you're back.
Yes,
thank you,
madam.
both of you. Can you please say a few words to all our attendees who have joined us before we leave and say goodbye to them?
Okay, madam. Very good evening once again, my beloved participants. On behalf of my co-speaker, Ms. Jayadarshana, and on my own behalf, I thank you very much for your patient hearing. And this is a wonderful topic. And I appreciate our IFERP organization and our Madam Mustafa Madam for nicely conducting, coordinating, and she spent her valuable time in spite of our busy, untiring work yesterday she could demonstrate how to utilize and all. And
Thank
we
you, sir.
really appreciate the patience level of our IFERP. When I say IFERP, I feel also a part of it, and also as a counselor, because I did MS counseling and psychotherapy especially for my students. That means our IFERP also has a vision or an objective to develop our next generation, as Fatima madam or Mustafa madam already said, to develop our future researchers, scientists. And with that aim, we have been, on behalf of IFERP also I am talking something, we have been conducting many international and events, and even in the different parts of India also many international events, where we have given opportunity for different academic and research institutions. But I expect more participation from industries also. There is the and from the general society public. And definitely this type of webinar with this theme is addressing all the people in the society. And I hope, I don't know exactly who are the participants in this register, but I wish and hope at least in the next time also, where the participants should be there from all the parts of the society, and should make benefit of all these activities. And that really will be motivating, inspiring our scientists, researchers, faculty, and for that matter, this our esteemed organization, IFERP. And in this count, I once again, at the outset, I extend my gratitude to our Mr. Siddhartha Saab, Pooja Madam also, along with Mustafa Madam, for inviting me to be a part of IFERP for a long time over the years, and for this specific event today, which is on the apt subject of artificial intelligence getting used and the impact of COVID-19. And maybe due to constraint of time, we may not be able to cover everything, but nowadays, at least I can say as a last word in this webinar, that nowadays this information explosion is there. And now those who are interested to learn, lot of database, lot of techniques, and those who are interested to see, they can simply go in and see, either in Google or any other apps, they can see lot of information. And I wish once again all the organizers best of their health and happiness in this COVID-19 period, and try to say only namaste, don't give hands to anybody. This is the requirement of COVID-19, and take only hot water. That's why I used to show, till yesterday I have been using this as my tool, Microsoft Team tool for online classes and evaluation. So only take hot water. That's what I used to tell. And then lysone, I mean garlic and adrak, these type of things, eat more. Then definitely we will win over the COVID-19 and give this type of awareness to many people, to the grassroots level, to every person, to spreading the humanity with good health and happiness. Once again, thank you very much, Mustafa madam.
Thank you, sir.
Fatma
Thank you so
madam.
much.
Thank you very much, Fatma madam. Later I could see your presentation, madam. It is nicely prepared, madam, but I could not see in full. But now Mustafa madam will send this video link to me.
Yes.
I will see in full. And
You need not worry, sir. We are streaming live on YouTube, and you can subscribe to our YouTube channel. All our videos will be available all the time. You can watch at any time. Even the attendees or registrants who have missed our live webinar, you can visit our YouTube channel and watch all our presentations at any comfortable time. So that is also a very, that is also a very easy option for all our attendees. You need not worry about it. You can stay at home, stay safe, and get all that you want under one roof.
Yes.
Yeah, you too. Thank you so much.
Very good. That means it will reach to anybody who are interested. Yes, madam.
sure.
Once again, just to say for Fatma, madam, we will be meeting you shortly, madam, after this COVID-19 in Malaysia. We missed the previous events. Although we planned, tried to take tickets, everything, we could not come over there, madam. Through IFERP, we are coming, madam, to your place,
Yes.
conducting various events there. Okay,
Yes,
madam.
we'll
Thank you
wait
very
for
much.
that day
You
to
can
meet
come to lecture
together.
when the
Yes.
situation
So,
permits. Yeah.
thanks and
Sure.
all the best for
Thank you
our
so much.
IFRP team. Okay, madam.
Thank you, sir.
All the best.
Thank
All
you
the
so much.
best.
Thank you, both of you. Thank you for joining us. Thank you to IFERP who has given us this opportunity. And thank you to all our attendees who are watching us from Webinar Jam as well as on YouTube. So you can share our YouTube link to all your friends who have missed us watching live and subscribe to our channel. You can also reach us on Facebook and all our social media platforms for all our upcoming webinars and call for papers. So make good use of it. Be part of IFERP. Thank you so much all. Good evening.
Thank you, madam, and Jai Hind from our side.
Jai Hind, sir.
Good
Thank
evening.
you. Jai
Bye-bye.
Hind. Jai Hind. Bye-bye.
Namaste. Namaste. Our best wishes to everybody. Okay, madam. Once again, Fatma, madam. Namaste.
Namaste to you too.